Good morning, everyone. It's Sunday, March 15th. Governor Charlie Baker joining us live in studio right now. Let's go on the record.
I'm declaring a state of emergency in Massachusetts.
Coronavirus outbreak and the dramatic steps to stop the spread. The governor and the commissioner of the Department of Public Health here live to discuss the necessary steps. We'll go on the record.
From WCVB Channel 5, the inside word from Washington to Beacon Hill. Today's newsmakers are going on the record.
And welcome to OTR, everyone. I'm Ed Harding. Good morning to you, along with News Center 5's political reporter Janet Wu. It's great to have you with us this morning, and we're joined live this morning by Governor Charlie Baker for an important reason, an obvious one, but an important one. We are discussing the impact of the coronavirus, a crisis that is being dealt with on not a minute-by-minute basis, not just an hour-by-hour basis. So, Governor, we appreciate the time this morning.
Speaking of minute, let's start with the latest news, which is South Boston is closing its bars down on the start of the St. Patrick's Day holiday. But there's also this rumor that's been going around the state that you are planning to set a quarantine for 14 days. Can you address that?
Yeah, I've actually heard this myself. In fact, I've had senior leaders in business, healthcare, politics. I've had community leaders and elected officials all text me or call me over the course of the past few days and say, I understand on Monday you're basically going to order everybody to shelter in place for 2 weeks. And the message has been exactly the same message. And I would just say, first of all, we have no plans to do that, although it does help me understand what some of the run on the supermarkets and the other dry goods and general stores would be about. But the other thing I would say is that people need to choose their news from trusted sources, and whether it's mass.gov/COVID-19 or many of the other available trusted news sources that are out there, there's so much information out there at this point in time, some of which is legit, but a lot of which is sort of wild speculation. I think it's important.
Is this wild speculation, this 14-day?
Yes.
And that's how you would label it?
And as Janet mentioned, the other part of it is the bars in South Boston are closed. At 11 o'clock in the morning, that's the breaking news. So what is your reaction to that? Is this the right step, I assume?
Oh, I think the city did the right thing. We put out a guidance earlier in the week. You had it up there on the screen, the emergency order followed by a limit on large gatherings at 250 that applied to all kinds of institutions and organizations. And one of the reasons why bars and restaurants weren't in it is because, for the most part, those are regulated at the local level, and we wanted to give cities and towns the flexibility to do what they thought made the most sense for them. I think I saw the news on the what was going on in South Boston last night. I think the mayor made the right decision by shutting it down at 11, and I think he's making the right decision by shutting it down today, and I hope he shuts it down on Tuesday.
Massachusetts now has the 4th largest number of confirmed cases in the United States. There are models projecting that the likely number of cases could be significant. Do you see this state of emergency that you've declared being in place 4 to 6 weeks from now, 2 months from now, into the summer?
You know, I don't want to speculate on how long I think it's going to be in place. What I can tell you is that the emergency order gives us the ability to do many things we can't do under traditional rulemaking. And a simple example of that would be in one day we were able to have the Board of Registration of Nursing adopt a rule that would make it possible for people who are not from Massachusetts but are licensed as nurses to be able to come work in Massachusetts in healthcare organizations that need the support. It made it possible for us to put in the 250-day large gathering prohibition. It comes with a tremendous amount of tools. We are also, by the way, going to be asking the legislature to do some things we can't do without a change in state law, and those kinds of things, again, will be driven by the facts on the ground. But I think the likelihood it will be gone in 2 or 3 weeks or 2 or 3 months, that's all going to be driven again by the facts. But my expectation is the goal here, remember, is to avoid the spike. Coronavirus, for 80% of the people who get it, is going to feel like the flu. For people over the age of 60 and especially over the age of 70 and 80, it is way more dangerous. It spreads like crazy. That's the biggest issue with it. It's enormously contagious. So the goal here is, instead of having a spike that goes like that, which overwhelms the healthcare system and the economy and everything else, is to spread it out.
So is it fair to say that...
Just let me finish. So if you end up spreading it out, then you probably leave the emergency order in place for as long as it takes.
Yeah. But do you expect that once the testing ramps up, which will be this week, that the numbers are going to be exponentially much higher by 4 or 5 days. Is that fair to say?
I think
Confirmed
the
cases.
change, the CDC's change in the guidance around who can get tested and who should get tested, which we've implemented, and some of the other federal changes they made to really bring the private labs into this space in a big way, who have capacity to do thousands of these. I think you're going to see tons more testing, and with tons more testing, yeah, you'll probably see a significant increase in the number of people who have been affected.
Let me share with you what we were talking a few minutes ago about, and what the most common question that I get is about schools.
Yeah.
Boston is closing its schools for 6 weeks to slow down the growth of the virus and preventing hospitals from reaching their maximum capacity as well. Most other school systems are starting with maybe a week or two of closure. As the governor, should you shut all the schools down? Let me ask you that.
Well, first of all, this is an evolving situation, right? And you want to make the decisions based on the best facts available. If you look around the country, states and municipalities are pursuing a whole variety of approaches to what to do with respect to schools. Because one of the recommendations and points of view that's come from a lot of the public health folks is, unless you actually shelter everybody in place when they're not in school, if everybody's doing play dates and birthday parties and piling onto the couch and sharing snacks and all the rest, you may not necessarily achieve the objective you're looking for here, which is the social distancing piece. And you do have places like New York City, where Mayor de Blasio has made pretty clear that he thinks kids in New York especially would not necessarily be better served if they closed their schools, and Governor Cuomo made pretty much the same argument. So I think for all of us, you take the best guidance you can get from the CDC and from your own public health folks, and then based on that guidance, make decisions. If one of your questions is, do I believe the other school systems or districts or schools, based on what happens as testing expands, are going to make decisions to close for some period of time, I think the answer to that is yes.
Well, the governor of Rhode Island, she closed her school statewide. So what about you? Still no? Right now, you're going to sit and, at the moment, no, you're not going to close them all right now.
If the facts change, then our decision process will change. I mean, the thing to remember here is you want to make your decisions based on the facts as they are. And there are plenty of folks in the public health community who would argue that just closing schools, if you don't actually do something about what everybody does once schools are closed, doesn't necessarily help you with transmission.
Do you think we can get to the point where we can be testing 1,000 people a day here in Massachusetts, which many experts say is what's necessary to really bring this under control?
Yeah, I think we need, yes. I think the answer is yes, we need to.
And how soon do you think we can ramp that up?
I don't want to put a date on it, but I would say it's certainly going to be our objective to get there quickly. The
president has talked about drive-through testing centers. Do you see that coming into play here in Massachusetts, and how soon?
I think remember that one of the reasons the drive-through testing thing is an interesting idea is it isolates the process of getting tested for somebody who's met a certain level of assumptions with respect to whether or not they might be infected. Moving it out of the hospital setting, moving it out of the doctor's office, putting it in a separate location, that's an isolation issue, which comes with, I think, significant benefits, okay? And I certainly think you will probably see soon that kind of thing going on in the Commonwealth.
So you know people that are actually putting this in place or putting plans together to have this happen. Will we see them like in the next week or so, do you think? Or is that too soon?
I hate to speculate on exactly what day it is, because I don't want to be held to a day, but I do believe that shortly you will see that kind of exercise going on in Massachusetts.
I'd like to talk about something else. I'd like to talk about the financial ramifications for most businesses and workers who don't have the option of working from home. And you know what I'm talking. I'm talking about those on the hourly wages, and for them, the expanded unemployment won't begin to actually close that gap. So, what can the state Can the state do something to help?
Well, I said earlier that one of the things we're going to be doing is asking the legislature for some help on some stuff that we can't do on our own. One of the things we're going to ask them for is help with respect to unemployment insurance, and we'll probably file legislation on that tomorrow. I've mentioned this to some of the folks in the legislature already. There's going to be a whole bunch of things that we're going to need to do as we're going through the process of ramping up testing and dealing with some of these other issues to deal with the disruptions that come with all this. And I certainly believe that's a big part of the exercise.
Before we have your Commissioner of Public Health join us in this discussion, I just want to ask you very quickly, will you get on an airplane in the next couple of weeks?
I don't think people should be doing any non-essential travel, okay?
And will you go into a restaurant to eat dinner?
As long as I think I can deliver on the social distancing issue, I don't think that's inappropriate. I think a lot of people are pursuing takeout from restaurants at this point in time, arguing that they'd rather do it, pick it up at the front window or the front desk and then take it home. I think that sort of thing is perfectly appropriate.
And I assume you have not yet been tested yourself?
I've not been tested. I'm not symptomatic.
Right, but will you, if you you later find out you've come in contact with someone that
of course.
may have been
And everybody should. Yeah.
All right, Governor. The governor is going to stay with us, and we're going to take a quick break. And then when we come back, Dr. Monica Burrell, the Commissioner of the Department of Public Health, will join us. She'll be at the table with us. Don't go away.